Hi, this is Brian Kim. I'm going to share with you a technique I developed on how to detect occult corneal erosions. Traditionally, the way we were trained to look for corneal erosions were based upon history of trauma and also based upon physical findings on the slit lamp examination, whether it was by staining or by visualizing areas of epithelial irregularity. However, this approach is grossly inadequate because sometimes patients have corneal erosions and there are no signs whatsoever, and sometimes no history for trauma. And there is a simple and easy way to directly detect these erosions without any equivocation and wondering what's going on. And most importantly, you'll be able to treat these patients with a superficial keratectomy and cure them of their problems. And so sometimes patients come in with ocular surface irritation, they're diagnosed with dry eye or blepharitis, and they go from doctor to doctor not knowing what's going on, not getting better. Please think about this problem. And if you perform the corneal sweep test, you will immediately diagnose the corneal erosion and you'll be able to treat this patient's problem and cure them of their ailment. So first, use a blunt instrument such as a corneal spud. I'm developing an instrument specifically for this technique, so please stay tuned. And number two, with the side of the instrument, gently touch and glide along the surface of the corneal epithelium. You want to angle the instrument in such a way that it gently glides and pushes gently down on the surface of the epithelium without creating an abrasion. You start from the far periphery in one area and move circumferentially and spiral in towards the center to ensure every part of the cornea has been checked. The area of erosion will be apparent because as it glides across the cornea, the epithelium will be loose and move with the manipulation.
So basically, we're trying to see where there's loose epithelium. And so what you do is use the back side of an instrument like this. You basically touch the cornea, just very gently. You just kind of gently touch. And there's no area right now that I see that's loose. See, nice and checking. But when you check right here, let's see, you check right here. There's one spot. Where did it go? Right there, see? Right here. She has it right there. A loose epithelial defect right there. So that is the erosion. You would otherwise not see it. Okay, you can sit back, sweetie.
So this is the technique I developed called the corneal sweep test, which detects occult corneal erosions. I encourage you all to try this technique because, again, there's a lot of patients suffering with this problem. It's an easy way to diagnose this problem directly and precisely, and you'll be able to cure these patients after performing a superficial keratectomy. I hope this was helpful to you, and thank you for your attention.